Welcome one and all. I am Ms. K. Kanimozhi, lecturer, Department of Hospital Administration in Sita Lakshmi Ramasamy College, Trichy. In this section, we are going to see about the chemotherapy and chemotherapy of leprosy.
Chemotherapy. Chemotherapy is a drug treatment that uses powerful chemicals to kill the fast-growing cells in your body. Chemotherapy circulates throughout your body in the bloodstream, so it can react to cancer cells almost anywhere in the body. This is known as a symptomatic treatment. Then the chemotherapy is used to kill the cells that are in the process of splitting into two new cells or a group of cells. Chemotherapeutic agents. There are two types of chemotherapeutic agents, namely bacteriostatic and bactericidal. Bactericidal means that inhibit the growth of bacteria in your body, and bactericidal. Bactericidal means they destroy and kill the bacteria in your body. And some other synthetic substances are used in chemotherapeutics, namely penicillin. Bacteriostatic antibiotic. Bacteriostatic antibiotic means that limit the growth of bacterium by interfering with bacteria protein protections and DNA replications and some other effect of bacteria's cellular metabolisms. This groups includes some other drugs, namely tetracyclines, sulfamides, streptomycin, trimethoprim and macrolides. Chemotherapy of leprosy. Leprosy is a disease that caused by Mycobacterium leprae. Leprosy is also known as a Hansen disease. This disease is mostly affecting the nerves, skin, eyes, and lining of the nose. And lining of the nose means a nasal mucosa, which can be easily diagnosed or early diagnosis. The treatment is given and the disease can be easily cured. Difference between a bacteriostatic and bactericidal drugs. Bacteriostatic means that agent that kill the bacteria. Bactericidal agent that prevent the growth of bacteria. Bacteriostatic, the action of this drugs is irreversible. Bactericidal, the action of the drug is reversible. Bacteriostatic, it do not work with the immune system of the host. Bactericidal work with the immune system of the host to prevent the growth and the reproductions of a bacteria. And bacteriostatic. Bacteriostatic means that inhibit the cell wall formation of the bacteria. Bactericidal inhibit the protein synthesis. Signs and the symptoms of leprosy. First one is discolored patches of the skin. Second one is that are usually flat, that may be numb or look fade. Look fade means normally the skin color is lighter than the affected area. The third one is the growth of the skin. Growth on the skin means the unwanted growth of tissues in your body. The third one is thick or stiff or a dry skin. Then the fourth one is painless ulcer on the soles of feet. Soles of the feet means bottom of the feet. Next, fifth one is painless swelling or a lump on our face or a earlobes. The sixth one is loss of eyebrows or eyelashes. There are minimum growth of hair in the eyebrows and the eyelashes is said to be as a loss of eyebrows. Symptoms caused by damage to the nerves. There are four symptoms, namely affected areas of the skin and muscle weakness or paralysis. Paralysis means especially the skins are affected in their hands and feet. And third one is enlarged nerves. Enlarged nerves means around the elbow and knee and in the sides of necks the nerves are bulged. Eye problems that may be lead to a blindness when the facial nerves are affected. Then the second one is symptoms are caused by the disease in the mucous membranes. There are two symptoms, namely a stuffy nose and nosebleeds. Classifications of drugs. There are namely four classifications. First one is cell phones. The examples of cell phones are dapsone. The second one is anti-tubular drugs. There are two examples, namely rifampicin and ethanoamide. The third one is phenazines. The examples of phenazines are chlorpheniramine. And fourth one is antibiotics. There are many antibiotics used for this treatment of leprosy. Some of these examples are minocycline and clarithromycin. Dapsone. Dapsone is an example of sulfone groups. Dapsone means a diamino diphenyl sulfone. Dapsone is a bacteriostatic drug. It combines with the para-aminobenzoic acids and it prevents folic acid synthesis. Dapsone is consists of C12, H12, N2 and O2S. This consists of 12 molecules of carbon, 12 molecules of hydrogen, 2 molecules of nitrogen and 2 molecules of oxygen and 1 molecules of sulfur content. Absorption, fate and excretions. It is completely absorbed from the gastrointestinal tract. The second point is it is widely distributed in the body tissues and fluids throughout total over our bodies. The third one is high concentrations of this reaction is present in the upper layer of the skin. Then the fourth one is the leprosy is mostly affected the skin layer. The fifth one is it is metabolized by the acetylation process. Acetylation process means it is a chemical reaction in which the hydrogen atom is substituted for an acetyl group. Next one is the waste metabolized products are eliminated through urine, sweat and tears. Adverse reactions of leprosy. The first one is sensation of a skin that lead to a exfoliative dermatitis. The second one is hemolysis in a patient with 6-GPD deficiencies. Hemolysis means breakdown of red blood cells. 6-GPD deficiency means 6-glucose phosphate dehydrogenase deficiencies. The third one is blood dyskaryosis like agranulocytosis. Blood dyskaryosis means there are blood diseases, breakdown of red blood cells. Agranulocytosis means deficiency of white blood cells. The fourth one is hypothyroidism and goiter. Hypothyroidism means the thyroid gland does not secrete enough thyroid hormones in our body. Blood dyskaryosis. Blood dyskaryosis means that anemia. This causes the decrease in oxygen transport in our body. Oxygen defect may cause us the 4 severe symptoms, namely decreased energy produced by the every cells in our body. The second one is trachydium. Trachydium means irregular heartbeat. Then decreased regenerations of epithelial cells. The fourth one is severe anemia. Severe anemia causes more diseases. Preparations and doses for the leprosy. The first one is Dapsone. Dapsone should taken every day 100 mg. There are some regular drugs, namely rifampicin, ethinoamide and chlorpheniramine. These three drugs are basically bactericidal drugs, and rifampicin and chlorpheniramine are less expensive to collected drugs, and ethinoamide is more expensive drugs. The rifampicin or ethinoamide and chlorpheniramine, the three drugs can be taken orally or injectably. It is most effective by taking an orally method. The rifampicin should take daily 100 mg and ethinoamide should take daily 600 mg thrice a day. Then according to the patient conditions, the chlorpheniramine drugs can be chlorpheniramine. Chlorpheniramine drugs is mainly used for Dapsone resistant leprosy. Then tuberculoid leprosy. The third one is for relieving a pain of LEPRA reactions. Then fourth one is it should produce a dark black color of the skin for the defect. LEPRA reactions. LEPRA reactions means the process of exacerbations which occurs the course of leprosy is called as LEPRA reactions. It is mostly affected by the various infections like malaria. LEPRA reactions are mostly treated by the drugs of chloroquine. LEPRA reaction types. LEPRA reaction types are namely two types, namely type 1 reactions and type 2 reactions. The type 1 reaction is also called as a reversal reactions. It means that represent the increase in the cellular response in our body and it movement towards for a tuberculoid pole of diseases. Tuberculoid pole of diseases means it is mostly affected the skin layer. It results from the activation of cell immunity then it expressed clinically by exacerbations of a skin and nerve trunk inflammations. This type 1 reactions shows their outer layer of the skin with a small point of inflammations with a small lesions of white color, and it leads to a sensory and a motor alterations. Type 1 lepra reactions, it delayed a type of hypersensitivity, and the second one is it occurred in a patient within the outer borderline of leprosy. Then occasionally there is occur in the newer layer of the skin lesions. Type 2 lepra reactions. Type 2 lepra reaction is also called as erythema nodosum leprosum. Its short form is ENL. Is also called as leprotype reactions. This leprotype reaction is more complications of lepromatous leprosy, and it is characterized by the development of inflamed subcutaneous modulus and accomplished at a time of fever and lymphadenopathy and some other common disease. Thank you everyone.